afternoon. Good afternoon, everyone. Thanks for bearing with us as we got logged on. I'm Avital Habusha. I'm the Vice President for Programs here at the New York State Health Foundation. And I'm excited that all of you are joining us today for one of our Practically Speaking series. Today, we're joined by Sandra Louie of Public Health Solutions, and we're going to be focusing on some of the critical issues facing New York City and New York State communities in terms of accessing the social safety net and benefits enrollment, and some of the lessons learned that we've found over the pandemic period, and especially some of those on the ground efforts that Public Health Solutions has been making. So I'm excited that you're all here to have this discussion with us. A few housekeeping issues before we kick off officially and introduce Sandra. We're recording the webinar, and we'll be sharing around that recording and a recap after the event. All of the participants, you as attendees, are muted, but you do have access to the chat box where you can type in some questions for the Q&A portion of the series. And Sandra and I will be answering those questions after we do a brief kind of Q&A between the two of us and discussion about some of the highlights we wanted to focus on. So without further ado, I will introduce Sandra Louie, who I've had the honor of working with over many years across different organizations here in New York City. So excited to get a chance to let her share some of the news from Public Health Solutions today. So Sandra Louie is the Senior Director for Community Health and Nutrition Programs at Public Health Solutions. She's been doing this work for 20 years, and she's overseeing at Public Health Solutions the enrollment services and access services into a whole variety of programs, but food stamps, WIC, and health insurance access are the three key anchor programs that she oversees. And she's been most recently engaged in several community engagement programs, launching those programs in the communities to really engage public housing residents, older adults, and we'll be getting into some of those details of some of those programs as we get into the conversation. But I wanted to really kick it off to Sandra, and we're going to be highlighting a few overarching areas, including some of the regulatory and policy adjustments that have been put into place to really facilitate access to benefits over the pandemic period. What are some of the continued barriers that we're seeing in terms of access to those benefits, and some strategies that Public Health Solutions has been employing to both leverage their partnerships in the community and their relationships with clients, but also to overcome some of those barriers. And then, of course, throughout, we're talking about some of the persisting disparities in terms of access among communities of color, immigrants, and other communities throughout New York and New York City. And so first want to really kick it off and give Sandra a chance to tell us a little bit more about Public Health Solutions, your role, and a little bit, if you could give us some highlights of some of the programmatic and policy changes that have been put into place over this last several month period to really ease some of those enrollment issues into various safety net programs. I think that would be a helpful place to start.
Sure. So first of all, let me say thank you to you for having me, and then thank you everyone for for listening. I'm really sort of looking forward to kind of talking to Avita about all of these issues. So first of all, Public Health Solution is really a very large nonprofit organization, the largest public health nonprofit organization in New York City. We've been around for 60 years, and our key role is really to address health inequities for the most vulnerable population in New York City. And so we try to do that in many ways. So first of all, we have a very contracting arm, a big contracting arm, where we are basically pushing money from the from the city and from the state into community-based organizations so they can provide all of the services that need to be provided. And we also have like a program arm where we address three key areas. One is health and food access. The second one is maternal and child health, and the third one is reproductive health. And so today we're going to be focusing primarily on the work that we do, that we do around health access and food and nutrition. And so, as most organizations in New York City, PHS was able to kind of pivot very quickly, during the pandemic, moving all of our services virtually, because we were already doing a lot of that work, virtual work, because we are equipped to move mobily to go help clients who are at home. So a lot of our staff was already equipped with, with most of the stuff that they needed to be able to do work virtually. So we made that pivot very quickly, but the state, the federal government, and the city were also very instrumental in making it possible for us to, to move those services virtually. So, for example, they eased a lot of the requirements and, made it very flexible for us to kind of to be able to help our clients. Let's take Quick, for example. At first, if you know about Quick, all of the clients have to come on sites 4 times a week to make sure that they can access the services that they need. So the federal government waived those the required presence for the most part. So 3 of them were completely waived, and they still have to come in if it is the first time that they're signing up. But that has helped a lot, making it possible for us to kind of help all the clients receive those services virtually. And, for SNAP, I think, if you know about SNAP, there is an interview that most people have to go through, when they apply for SNAP. So this interview was waived. There's a lot of flexibility that was put in place also in terms of the paper requirements. And then also they've put in place the pandemic EBT to make sure that kids who are in school and who are getting school lunch and who are now no longer in school are getting some money for school. So they have $420 added on their parent EBT card. And if the parent was not already enrolled in EBT, with a program where they have an EBT card, a new EBT card would be mailed to them. So, for health insurance enrollment, I think, navigators are now able to help people over the phone.
I think that maybe we have a little bit of a sound issue. Sandra, let's see if we can hear you now. Oh, a little bit of technical difficulties. We'll see if we can get Sandra's sound back. I think we hear you. Go for it, Sandra.
Okay.
You just cut out right when you got into health insurance.
No,
the world of technology. As you were talking, you just got into telephone visits for health insurance enrollment.
Right. So, our navigators are now able to help people over the phone, apply for health insurance. And so, that is, continuing. But, what we found is that it's also very important for us to kind of make sure that we are retaining some of the flexibility moving forward, even after the pandemic, because, as we know, the more flexibility people are in ways that they can, enroll in some of these programs, which are so crucial for a lot of our families right now, better off that we're going to be. So, if a family has, the possibility of enrolling online and also coming to our site, depending on what works best for them, we think that, it's very important that we keep a lot of the flexibilities going forward.
Great, thanks, Sandra. So yeah, it does sound like, some of this flexibility has probably started to translate into increases in applications and enrollments. And we all, we're of course all know the, intense economic downturn that we're facing and the increase in demand that we're seeing across the board for a variety of benefits across different food, health, and other needs. So I was hoping you could talk a little bit about how some of this flexibility and your enrollment services have started to translate into those increases in access, and what are some of the barriers that you're continuing to see remain even amidst the increased demand in enrollment?
Yeah, so I think the jury is still out on whether we're going to see a huge increase in enrollment. I think part of it is because we're still fresh into the process, and so but we can definitely say that we've seen a big increase in requests. A lot of people are accessing our website. A lot of people are wanting to kind of connect with us and wanting to apply for benefits. we know that we've seen, the small data that I've seen so far shows some increase in SNAP, some increase in health insurance enrollment, particularly for the Child Health Plus population. But, for one of the population, which is the older population, we've seen a decrease in enrollment. And at PHS, we've also seen the same thing. And part of the reason is because of how difficult it is for that population to access, virtual services. A lot of them don't have smartphone. A lot of them don't have access to broadband, don't have access to the internet. So it's very difficult for them to access those services. So that's definitely very important. But I think there are other barriers that kind of remain, also across the board. For example, Public Health Solutions did a recent survey of our clients. I think we surveyed about 1,000 people, and then 25% of them said that they didn't have health insurance prior to the pandemic. 16% continue to not have coverage during the pandemic, and then 7% lost their insurance, during the pandemic. So that's, showing us definitely barriers in health insurance enrollment. I think our partners or colleagues at Make the Road also did a survey of their clients where they find that, 75% of people lost their job, but only 15% were people to access like government help after they lost their job. So that's definitely showing us, showing need. And then I think I've also seen a recent survey that was done by the Domestic Workers Alliance. And so the survey is basically showing that 50% of people that were surveyed, so it was about 800 people, 50% of them, and they live in Massachusetts, I think Florida and New York. 50% of them said that they are afraid of really accessing government services during the pandemic. So whether it's federal, local, or state. And so we believe that's definitely, showing major issues with remaining barriers to enrollment. And as I mentioned earlier, the older adult population with technology is definitely a big issue that we're seeing in terms of barriers to enrollment.
Absolutely. And can you, maybe share a little bit more about, I know there are many community-based organizations that have that ability as either facilitated enrollers or as SNAP enrollers or other, to kind of bridge that gap between some of the government agencies and clients and patients in terms of getting those questions answered, that step-by-step process. What are some of the things that you're able to do, and other community-based organizations who have this role are able to do to kind of bridge that gap and help people connect and learn about the services that they might be eligible for?
Yeah, well, we try to find multiple ways to, to help people. I think, for example, when we talk about technology, a lot of them don't have a cell phone, for example, but they may have access to a fax somehow, where they can fax us something. So I think we talked a little bit, earlier about how the Access NYC website was sort of like breaking down a lot, in the beginning of the pandemic. It may still be breaking down still, but I think, a lot of our enrollers also have access to, to Maru, where they can fax, a paper application to, to HRA on behalf of on behalf of a client. So that's definitely, a great advocacy role, and, that we play in terms of making sure that the clients are receiving, the benefits that they need. For older adults also, we kind of work a lot with family members. We also work a lot with aides who may be in the house, to make sure that we're helping them. And of course, we are as patient as we possibly can be, just to make sure that we're walking through all of the steps with them.
Great. And I think that one of the things I kind of building on that a little bit, I know that Public Health Solutions approach has always been this idea of really connecting people to multiple benefits at once as much as possible, and really making sure that all of their needs are met kind of holistically and in a one-stop shopping, so to speak, approach. And I'm curious if you could tell us a little bit more about maybe how you've built on that during this pandemic period. There might be some lessons learned there for others in terms of leveraging partnerships to make sure people are accessing kind of as much as they can from one visit or interaction with a community-based organization.
Yeah. So, I think, as you know, our model has been sort of like a one-stop shop. So, all of our WIC programs are sort of like, co-located with health insurance and with also with SNAP. And we also make sure that when we're working out in the communities, that we are, using the same model. For example, we partner with health and hospitals for our food and nutrition bundle. So we are at multiple health and hospital sites, and so we have navigators that are co-located, food navigators that are co-located at those sites. And then what they do is basically help people with all of their food needs in one platform. And we also have this new project that we're working on in East Harlem called the East Harlem Village. And so it's a similar model where we are partnering with several community-based organizations to make sure that we are providing all of the services that a senior might need to age in place. And so that includes food, that includes social activities, that include, access to a whole host of services that they need to kind of help them stay at home and stay in place. And
can you maybe speak a little bit more in terms of, what it looked like, especially during the kind of height of the pandemic, what it looked like in terms of that work you were doing at health and hospitals, and how that might have shifted during the moment when the hospitals were seeing a lot of COVID patients and being quite overwhelmed?
Yeah, well, I mean, I think, because we are working in those communities, because we've been working so closely with partners inside the communities, the model is really built on, on trust and relationship, build trust and relationships. So because we were already inside the hospitals, we were able to help, our hospital partners with some of their discharge planning issues that they were having with, for COVID-19 patients who were also in need of food. And for, for the East Harlem Village, we were able to, work with the partners inside several NYSHealth developments to make sure that we were able to deliver emergency food to some of the seniors and other populations who live inside the NYSHealth. And this is based on the work that we were doing prior with the tenants associations, with a lot of the seniors that live inside the buildings. So yeah, we're able to leverage our model of cooperation, of collaboration, of trust building to kind of expand on that during the pandemic.
Great, thanks, Sandra. So I'm curious, maybe we'll shift a little and get to sharing some resources. I just wanted to ask you a little bit more about Public Health Solutions' approach to some of the most recent events in terms of how, the underscoring of the, extensive disparities in terms of access among communities of color, in immigrant communities, in other marginalized communities. And we know, I know Public Health Solutions survey indeed showed that that people in these communities that were your clients and others were very worried about things like running out of food and having money to pay for their medical bills. And obviously that also bears out in terms of some of the rates of under and uninsurance in these communities, and also rates of food insecurity. So I'm hoping you could just speak a bit more about your thoughts on the role of these programs in terms of addressing some of those issues and some of these disparities, and also just some of the broader contributing factors that you're thinking about at Public Health Solutions.
Sure. So, obviously, the safety net programs are very important in this period, because that's what people rely on to kind of get them through through this very difficult period that we're going through. And obviously, we want to make sure that we keep them in place and that, we use them as much as possible to provide, the help that people need right now to get to that, to get to the next step. And so, but, when we really think about it, as an organization, we really think, this is really a poverty issue. And it's a jobs issue. It's a good jobs issue. I mean, if you really think about it a little bit, you could say that, a lot of the safety net programs that we're providing kind of, subsidize low-paying jobs because, our employers feel that they can pay people low wages because, they can possibly get. I'm so sorry. Because they can possibly get on public benefits. Mm-hmm. And so, at Public Health Solutions, what we are doing is, is really think about, is there ways that we can change that? We know that, for example, the system that we are kind of, operating in right now is a system that is built on extraction, extraction of labor, extraction of productivity. And so, a lot of people are working for very little money to benefit a very, minority. And so, how can we help change that at Public Health Solutions? And, one of the things that we're thinking about is there a way that we can, help change some of the policies around WIC and around SNAP, to kind of address some of these issues. For example, is there a way, for example, that WIC and SNAP could be used to purchase, nutritious and delicious food that is prepared in the community by by vendors in the community to start sort of like keeping some of the wealth, in those communities, because we know that, the supermarkets are sort of like coming to the community and then they go out, purchasing with SNAP, with EBT on Amazon, sort of like enriches Amazon more, but the money does not really stay in the community. Is there a way for us to kind of think about sort of like, work, changing some of those policies for WIC and SNAP so the money stays in the community more in the short term? In the longer term, is there a way for example, for these vendors to kind of work in worker-owned co-ops? So, for example, they can contract with the city to provide school lunch. Could they contract with the hospitals to provide, hospital food? Is there a way that they can, possibly contract with other institutions in the city? And all of that money and all of that wealth would kind of stay in the community. And so that's what we're kind of thinking about at Public Health Solutions. And we know that there are plenty of other organizations that are thinking about the same thing. And, we hope that we're going to be working, with them to kind of make some of those changes in the future.
Thanks, Sandra. So, we have a few minutes left. So I wanted to make sure we get some of the questions answered that we're seeing in the chat box. So feel free to type any questions to us as the panelists, and happy to throw those out to Sandra. I'm going to pose one question, and if we have some time at the end, we will share some resources, but otherwise we'll be making sure to send around all of the links to the various things that Sandra mentioned throughout our discussion. So first, just turning it over to one of the questions, I think there's a little bit of a theme in the questions. One being, I think there's this question of, once people have the access to their benefits, how does Public Health Solutions partner with or make referrals to some of the community-based organizations who are delivering some of those healthcare or social service needs and human service needs to the clients themselves? So once they've got the benefits in their hand, how are you helping bridge those gaps so people are able to access the services they need that are often provided by some of the CBO partners on the phone today?
Oh, sure. Well, I mean, obviously, when we help somebody apply for health insurance, for example, it doesn't say that, at that. We basically also help them how show them, teach them how to use their health insurance, and so how to, access their primary care provider, how to, the way to kind of use the health insurance preventively, so they don't, they don't end up in a, hospital emergency room. We also make sure that, as we work with clients, is if we find that they are eligible for other services, that we refer them to our partners. A lot of the time we call those partners to make sure that we are making a warm referral, to the person who is working with us, who's seeking services at PHS.
Great. And I know that you have some, formal partnerships with some of those CBO groups who both help with your enrollment and service delivery. How do you identify, I know you're in many communities throughout New York City. What's the type of work you do to identify in terms of language and community, what access those clients need, and which organizations you're targeting kind of to partner with in those communities to meet the various language and other needs of your clients?
Right. So, I mean, obviously, when we are in a community, we really want to make sure that, the navigator or the SNAP enroller speaks the language of that community. So, our navigators are really multilingual. They speak a lot of different languages, and the languages normally match the communities that they're in. But we also have access to language lines to make sure that, if we receive, if a client needs a service, that they are able to access in a language that they understand.
Great, thank you.
I don't know if that answers your question.
No, that's great, thanks.
Okay.
And I know we only have a few minutes left, but I think a few of the other questions are some specific questions about kind of how the policies around SNAP have changed in terms of people's eligibility once they start to receive unemployment, and do people have to wait until their employment is out to receive services? I think you probably can't speak to all of the details now, but one of the things that I think would be helpful is we will make sure to share around with all of the audience right after in the next few days after our panel. We have a few resources around who to call at Public Health Solutions and other organizations to answer some of those specific questions. The enrollers are now kind of expert in what has changed in terms of eligibility and access. And I think, so we make sure to share that with you all so that you'll have access to give a call to someone at Public Health Solutions or one of the other CBOs doing this work. And so that will come out right after the call, but thanks for those questions. And then I think another theme that we're seeing is, this idea of which Sandra spoke to at the beginning. How can we advocate to keep some of these lenient policies in effect to keep people being able to maintain access? And I think that's a discussion we'd love to continue, and Sandra and PHS would be definitely open to talking about that. So we'll make sure people have contact information to make those connections and keep those discussions going. And, somehow a half an hour goes by quite quickly. Already, right. And so just wanting to make sure that we keep people on time, and we will make sure to share information so people can continue to connect and talk to Sandra after. We'll be sharing around resources where a lot of these policy changes have been listed, how to access services for your clients, for yourself, and some of the survey data that Sandra mentioned throughout the call. We'll provide that as well. And so we really appreciate the time the audience has taken to spend with us during our lunch hour right now. And we really hope that this spurs some additional conversations about connecting clients and, making some effective policy changes into the future. Thank you to Sandra and her team for all of the work they're doing to connect New Yorkers in need right now. And we'll be continuing the conversation here at the New York State Health Foundation around some of the practical steps our partners and colleagues are taking during this time. Next week, stay tuned on our website, and you may have received an email. We have another event coming up on the 23rd with the New York University School of Medicine, and that will be with Dr. Justin Feldman. So if you're interested in that, check out our website, and we look forward to seeing you there. And thank you again to everyone for your participation, and to Sandra and her team. Thanks so much.
Thank you so much. Thank you so much for having us.
Great.